I'm Meg Simmons with Henry Schein, Equipment Specialist, and I'm here with Dr. Sara of Magnolia Pediatric Dentistry in Lancaster, PA. Thank you so much for sitting down to chat today. I'm excited to talk with you.
Me too.
Yeah, your office is beautiful.
Thank you.
And I was really inspired when I first met Karina and you, Dr. Sara, and got to hear about some of your vision of this space. And today I'm just excited to hear about what inspired you to create this and some of your philosophy and approach in pediatric dentistry. I think it's unique and special and something that's really needed. So to get started, when you first built this space, I think what was most impressive to me is that you not only created a really nice space for your pediatric patients, but you also seemed very intentional about creating a space that supported parents and caregivers. Can you tell me a little bit about your vision for your office?
Sure, and thanks for having me. I'm really excited to chat in this capacity. We've met in other circles, but this is really nice to do today. So thank you for coming out here. I appreciate it.
Of course.
So you're absolutely right. So obviously kids are at the center of everything that we do here at Magnolia, but I also wanted this to be a safe space for moms and for dads, but especially for moms. There's a lot of, as a mom myself, when you go to a provider, you are looked at like you have 100 heads. Not all providers, but a lot of times your concerns are dismissed or minimized. And, instead of having a conversation about it and taking it on board, maybe that's not the thing you're thinking, but taking it on board, it's completely dismissed and you're made to almost feel like you're crazy, like your thoughts are coming out of left field. And then you go home feeling, upset or foolish or just discouraged, and you still don't maybe have answers. So I wanted moms to come to the practice and feel like I'm one of them, which I am, and I understand where they're coming from, and their concerns are valid, and moms know their kids best. They know them better than anybody. You can read any textbook and it will not substitute the amount of time and expertise that parent has for their child. And so I really respect when moms come in and have an opinion about what's going on, and I'm like, that certainly could be a part of it. And then I'll add my doctor hat and say, like, well, let's talk about it from this perspective as well, and then we can come to some agreement about what's best treatment-wise.
Yeah, I think that's beautiful. As a mom too, I fully recognize and can relate to those appointments where you might have felt dismissed, or on the other hand, where you come in and you actually feel seen and that your concerns matter, not just what's going on with your child, but you as the caregiver. I think that's really special what you built.
Thank you. I appreciate that.
Absolutely. So what has been the most rewarding part for you of opening up this practice and seeing it come to fruition?
Just the conversations that I've had with moms. Maybe it's a little selfish, but it feels cathartic for me to have these conversations with moms and to feel like, okay, they're seen. And then I also have, a jumping off point to talk to them about my, what I went through as a parent, a first time mom. It can be, like I said, discouraging, but it's nice that we have that to in common. So to talk about our experiences and some of the things I thought, then they validate. And the moms that come to the practice are so savvy. They do a lot of research, they ask really good questions, and they encourage me to be better and to get smarter and to learn more. So it's a give and a take. Like, I'll share with them what I know, and then they'll share with me what they know. And this whole community is kind of growing together in knowledge and, like debunking myths or sharing new facts or new things that they've learned. So it goes both ways. So that's been the most fulfilling. Is as a provider and a person, I'm constantly growing and expanding to serve the community. And I don't know that I would have had that in any other environment, because here specifically, moms are really hungry for more knowledge and more holistic healthcare. And so it's really it's been really amazing for me and impactful for me to kind of go out and learn more so that I can share that with them.
Yeah, that's really special. I love how you have taken a more holistic approach in your pediatric dentistry. Two things. What inspired that? And for people who may not be privy to what holistic pediatric dentistry is, can you tell me a little bit more about what that means?
Sure. So being a holistic provider just means that you are offering low tox alternatives to your families, and that you've taken hopefully some extra courses to learn about how whatever organ system you're dealing with, or maybe you're a general care provider, how diet, nutrition, and daily habits can impact overall health. And then alternative forms of medicine. So maybe instead of jumping right to traditional allopathic brand name medicines or surgeries, you're trying a more conservative route first, trying to diagnose the root cause. That's really a big word, big buzz phrase in holistic health is root cause, so that you're treating the issue instead of just putting a medicated Band-Aid, if you will, on top of the problem. Holistic has a very fluid meaning depending on who you are. Anybody can say they're holistic. It's really unfortunately, up to the consumer or the patient, the family, to really look into it and see what alternatives does that provider offer. Are they truly aligned with my beliefs? Because there's a whole spectrum of what it means to be a holistic provider. But can I make an announcement?
Yes, please.
So
please do.
I, as of last week, am officially a certified biological dentist.
Congratulations. That's a big accomplishment.
It's huge, through the IABDM. So that's the international board that is for biological dentistry. So that was a lot of work, and I'm really excited a lot of CE classes. But it's worth it, and I'm still growing and I'm still learning. So it's like a stepping stone to the next. I'm the only one in PA that is a pediatric.
Nice.
Yeah.
That's very exciting.
Dentist. Thank you.
I think there's definitely a need for it, and
for sure.
People, parents, caregivers are searching for someone who can have some of that approach and provide alternative means. If you would be open to sharing with other pediatric dentists who may be considering taking that approach, what kind of advice or thoughts might you share with someone who is considering that? Because there's a lot of work and effort that you put into that, lots of research, courses, time, all of that. What might you share as a piece of advice?
Sure. So there's like two components to it. There's the at-home component, your own lifestyle. Like, this is my life. I live this lifestyle. And it kind of bled into the business aspect of it. Okay. So I would say there are some approaches you can adopt to sort of embody it that will help feel more authentic when you are actually going for certification. So things like, and we can talk more about this later too, but I'll just briefly talk about it. What you eat, candles versus essential oils, the products that you put on your body, things like that, the clothing that you wear. And then it doesn't have to be perfect, but just starting to sort of get rid of some of the higher tox. We know so much, and just introducing lower tox things. And then business-wise, if it's something that you're interested in as any dentist or a pediatric dentist, you can research. There's two big international committees or boards. One is the IAOMT, and that's more chemical-based chemistry, literally the materials that you use in the dental practice, making sure those are like low tox or no tox, or that kind of thing. The IABDM is more about nutrition and holistic health, and how does the dentistry impact you at your body.
Got it.
So there's slightly different approaches. I prefer the IABDM just because a lot of my families come in wanting to talk about nutrition, use of ozone. We have an ozone machine. So things like that. So more natural methods. And the IAOMT is just a little different. They're talking more about chemicals and things in the products that are used. So I went the IABDM route. I would go to those websites and just research and see what's required to kind of go through the process. For each of them, they call them different acronyms because we love acronyms in science. So the IAOMT has what's called the SMART protocol, which is for amalgam removal, safe amalgam removal. The IABDM has a very similar protocol called the PROTECT protocol.
Okay.
That's for smart amalgam removal. So just depending on what path you decide to go down, then just follow the path. They have them listed out, the courses that you need,
okay,
all the requirements that way. I can only really speak to the IABDM because that's the path that I went down. Everybody there has been absolutely fantastic. Dawn Ewing is such a huge resource. She's been so impactful for me going through this journey. Easy to reach and really transparent and so helpful.
That's great.
And giving me alternatives. And we were just going back and forth the other day. I had to do a case presentation.
Oh, okay.
And she was just going back and forth like, well, what does this mean? And like, let's try to talk about introducing this into your practice, and giving me really great ideas. So she's a great sounding board for that. So if you're interested, you can always reach out to me too. If you have any questions, whoever is interested in it, because we definitely can benefit from more in this area for sure.
Absolutely. Having someone in your corner to kind of help walk through what your experience has been is really helpful. I'm glad you had that.
I had a friend from grad school who just opened his practice in Texas, reach out to me, and he is fantastic.
Yeah.
And he, I guess, had seen some of the posts that I had made on social media, and he said, I see that you're kind of doing this thing. Had some moms come in, and it starts out with the toothpaste. Always toothpaste.
Oh, I believe it.
What are cleaner toothpaste? So I had like an hour-plus long conversation on just toothpaste.
Yeah.
And the kinds of questions the moms are probably going to ask. He's like, yeah, wait, I had one mom come in. I said, you had one. There's going to be like 20.
Now there will be more.
Yeah, there will be more, especially in Texas. So,
yeah, I'm sure. So that's special.
Toothpaste is usually a big...
The opening question. And then
it's the gateway question. And then it's all holistic from there.
Yeah, that's great. That kind of leads me into the fact that you have this approach of holistic dentistry, and that approach is full body health, right? Not just oral health. So what's your take on how oral health affects whole body health and development in a child?
Yeah, it goes both ways. So a lot of times systemic diseases manifest in the mouth, and that's the first time we can visualize or see it. And then sometimes things start in the mouth and they have secondary effects to other body systems. So it goes both ways. So the mouth is a really important portal and gateway to the rest of the body.
Yeah.
It's so important. Our teeth, dental health, our gum health, tongue health. And not only that, there's a really big area in dentistry right now for airway health. And a lot of it starts in the mouth. Not all of it. Some of it's internal or maybe neuro, but the mouth is a huge component to airway health. And so getting kiddos for early expansion, trying to prevent dental extractions, sometimes they're absolutely unavoidable when the child is older. Yeah. And you can't really move the bone, but that's why there's such a push to start expansion at a younger age, because the palate or the roof of the mouth is really malleable. And so you can get some nice expansion that way. Again, it's not always the case with every child. Sometimes it's a multitude of factors, but certainly expansion can help a lot of downstream issues. And I could go into that. It's a whole other topic, but I'll just stop right there.
Yeah, no,
airway.
That's great advice.
Yeah.
I could go into, we kind of talked about oral health impacting things like sleep, behavior, growth. I don't know if we want to dive into that specifically.
That's what I was saying. There's so many things like with that. Again, it could be like other things, but parents don't realize like sometimes bedwetting from mouth breathing, and like if you have a really high palate, your tongue's not resting where it should, that can create speech issues. If your tongue isn't doing what it needs to, you may or may not need a tongue release. Sometimes it's just you need to strengthen those muscles, and then you can refer to myofunctional therapist, and that's a whole other. I've been keeping my myo friends busy with the referrals. And one of my friends said to me the other day, she said, it's so crazy. Once you see it, you can't unsee it. There's just a very characteristic face for it. Again, I say every child is perfect, but if I'm doing my job and I'm doing the analysis that I know, I can tell when I look at a face whether it's like concave where it's supposed to be, or how protrude the chin is. If we have, maybe a discrepancy between the top and bottom jaw, or if they have dark circles under their eyes, congestion, their eyes look kind of slant, like just kind of turned down. They have constant ear infections, that kind of thing.
Yeah. Hi, how you doing? Hi. Come on in. You're good. We'll edit it out. Or you can be a part of it.
Usually I'm behind the I'm so sorry.
It's all good.
I did want to say one thing though.
Yeah, please.
It was about the holistic dentistry versus biological dentist. So if you're looking to see if someone is a certified biological dentist, that's a trademark term. So if you go on the IABDM website and you type in, your geographic location or zip code, somewhere that's close to you, and the list of dentists come up, some of them may be members, but not certified. So maybe try to seek a provider who is certified. And then on top of that, if they, say they do certain type of amalgam removal that is safer, check to see they have the seal that they need to have, and that they're also listed on the corresponding site, whether it's the SMART protocol or PROTECT protocol.
Okay.
Because a lot of people, unfortunately, will say they do things a certain way, but it needs to be vetted by those boards.
Got it.
Yeah. So, and then holistic too is such a broad term, but a certified biological dentist is a trademark term that is earned with like a certificate and like a lot of hoops you have to jump through to make sure that your practice has to get vetted.
Sure. So, lots of education, hours spent.
Correct.
Yeah.
Yeah.
Well earned, I'm sure.
And still learning.
Yeah. That's good. That's all part of the process.
It is.
Awesome.
Yeah.
Okay. So what would you say, kind of switching gears here, what would you say is the most underrated habit for kids for good oral health?
Underrated habit. Okay, so I will talk about something that is not so much a conscious habit. A lot of it is unconscious. And then I will talk about something parents can do to help. So mouth breathing is an unconscious habit that a lot of kids have that significantly contributes to cavities. And you can be doing everything right. Excuse me, you could be brushing twice a day. You could be using a mineral toothpaste. You could, minimize snacking. And if you're mouth breathing, you are going to have, again, for children, a dry mouth is a road straight to cavities. And so again, flossing, doing all the right things, good diet, but you're going to end up with cavities. So that's why I would say, check on your kids at night. A lot of them are sleeping in their own rooms, and they, parents are just blissfully unaware, but maybe they'll hear them snoring, and then that's usually how it starts.
Okay.
I heard them snoring, their mouth is open when they sleep. So that's one unconscious habit. And then go to your pediatric dentist and see if they can get an airway dentist, which I am an airway dentist as well. So see if you can get, some kind of screening for them, and then appropriate referrals as needed to see what the root cause is, whether they need a tongue release or expansion or myofunctional therapy to strengthen those muscles of the mouth. So that they can start nasal breathing.
Okay.
And then the other thing for parents to do is I want to say minimize snacking throughout the day. And if we are going to snack, just try to make them healthier choices, less gummy. If we're doing carbohydrates, just try to brush. It's hard. A lot of my families that come to the practice are homeschooled, so it's a double-edged sword. They have access to the toothbrushes, but they also have access to snacks throughout the day. So again, it's very practice specific. I have a lot of homeschool families, so that's what I tell them is if you're going to snack, these are the healthy snacks to eat. Low from, we want fermentable carbohydrates or carbohydrates that they mix with the saliva, and then they are caked around the molars, and you see very characteristic rings of white decalcified enamel along the gum line. I'm like, okay, we need a lot of snacking
going
on.
What, as a mom and pediatric dentist, what's your favorite go-to, easy, I'm busy, need something to quickly grab for my son to have a snack?
Yep. I'm very fortunate or unfortunate. I love like pasta and bread and pretzels and all those things, and he doesn't.
Okay.
He's a meat and cheese guy.
Nice.
Which is great, but it's also like, oh, no, I can't eat those things because I just don't bring it in the house.
Yeah.
So for him, he likes cheese. So we'll do cheese.
Okay.
He likes those, skinny almonds, the chocolate covered almonds.
Yeah.
He'll eat those.
Okay.
And I'm just trying to think about, he loves berries.
Nice.
Which are so expensive.
Yeah, they are. They go quickly.
They're low. Yeah, they're low in sugar, and it's a good snack.
Yeah.
So he'll have that, and he might have a cracker. Yeah, if I can get a cracker in there.
Got it.
Yeah.
Got it.
So that's what we're working with.
Good advice.
Yeah.
I like it.
Yeah.
So, Dr. Sara, what does a first visit look like in your office as compared to a more traditional pediatric setting?
So a first visit typically looks like a family will come in, and the children will immediately run to the toys. get acclimated with the space. And we'll check the parents in, ask them if they want any refreshments. We have a probiotic soda. Next month, we're going to have an ozonated water machine, so families can have that with their liposomal vitamin C, because you want to combat the free radicals. It's a holistic thing.
I have more to learn about that.
And then we'll bring the family back. Our dog Bodhi is running around. He's a mini golden. Sometimes families want him put up, whether it's for a variety of reasons.
Sure.
So we sometimes have him put up in his luxury kennel. But usually he's running around playing with, most of our families have multiple dogs, so or farms or farmettes. So they love having Bodhi. Yes, exactly. So he'll go back there with the families and show off his toys. And so it depends on whether the family wants a quieter experience or they want their kid to try the big kid chair. So we have our quiet room where moms can go sit in what was my old nursing chair with their little ones, and we can have a first visit that way. It's very, very low stimulus. And there's a sound machine, like I said, a nursing chair. Everything's just really calm and very cozy, and we can do first visits there. And a lot of families are really surprised at how well their children do. They're like, I didn't know how well they were going to do, or I was worried about how this was going to go, but it went well, and it usually goes better than they think. Sometimes there's a little crying, obviously.
It's new.
But for the most part, kids, or they recover really well, really fast. So it's just because I think it's a low stimulus and everyone's just, I'm in, I'm out, and then we have our conversation. And then the kids can go back to running around. If they want to try it in the big kid chair, we have an open bay with our one chair. That's the only one. That's our dental chair. And there's a beautiful window right there so we really try whenever possible to turn off the overhead lights. There's a number of things that I don't love about the fluorescent light, and the health concerns about that poses too. But a lot of families appreciate it. And so it's great, and I get such good lighting. So we do our exam. If we need to take x-rays, we do. It is a prescription, so we talk about when they had their last x-rays, if they need x-rays, and if not, and so I talk about all of that with the family, and if not, when we will take them. And so we talk about concerns or questions that the family may have, and then we just have one television on the wall, but some families prefer to have it off, so we always ask first. It's not just blaring. We don't have a TV at every station. We just have the one. And then we get prizes at the end. So in terms of flow, it's very similar, but if you kind of bear down, we have a very long conversation. All of our new patient appointments are 1 to 1.5 hours long, which
very unique.
It's very unique, especially for pediatric practice. And that's the only family that's here. And we get a chance to really dive into a lot of questions families have, and sometimes they'll have a sibling there that's not part of the appointment, but like they'll say, hey, come here, and we'll look and we'll talk, and then they'll schedule that sibling for the next visit. And I'm like, hey, bring the whole family, because every child is unique and different. So all the questions they have are unique and different. And then we'll see them. And so another thing we do is, because we aren't high volume on purpose, a lot of our appointments are follow-ups. We do intervals like 1 month, 2 months, or 3 month follow-up visits. So they're not going for 6 months without a check, or if we're watching a tooth, keeping an eye on something where a cavity may be starting. Families want to wait on treatment, depending on what it looks like. I can wait, and then they'll come back in, but at a sooner interval than 6 months, because I don't want it to get to a point where it's not good. And then we talk about alternative, medicaments or things they can try that are more natural or low tox, and families really appreciate that. So we just have a conversation about everything, and then we often go off tangent talking about other medical everything.
Yeah, I'm sure. It goes back to the whole body health and all that plays a role.
For sure. So that's why our first visits are really long, but we have a lot of fun toys for the kids. They don't seem to mind. They don't want to leave.
I believe it. With the prizes and the environment, Bodhi, the dog.
I know, Bodhi. Oh, I'm like, they play with him, and he gets so tuckered out.
I believe it.
They throw the ball up and down the hallway. So.
That's great. Was there anything else that you want to share about the way that you practice and what inspires you most about pediatric dentistry and your approach?
Yeah, my son inspires me. The whole setup of the office is more of It was Montessori inspired, so a lot of the toys are lower just so children can reach them. The books are lower, and we have like a steppy stool in the bathroom so kids can reach and access the sink. We have a free library. You know, literacy is so important to us. We also have like a fun bring your reading login at the end of the summer, even if you're homeschooled or with the library. I will give you a prize just to encourage that. My son loves to read, so we will share books. I know books he's loved I've brought into here, and so he's kind of the inspiration for a lot of the things. And I just want kids to feel comfortable and safe, because when I know my son feels comfortable and safe, he opens up and he won't stop talking. And the same is true, really, I think, for a lot of kids. So we wanted them to feel comfortable and safe. And for that, we only see one family at a time. So, you know, a lot of our families have multiple children, and they drive from far to come to see us. And we basically will shut the door, and it's just that family. So we'll only see maybe one or two kids, but then they'll bring all of them, and then they'll just play, keep each other entertained, and we'll see, you know, one child at a time in the back. And we can have a really great kind of deep conversation with the family about whatever their concerns are. We just kind of go through the kids, and we may not see the whole family. And then they'll come back and we'll see the other two, for instance. But it's nice that it's always just one family. So kids aren't overwhelmed, and they feel really safe and sure of their surroundings. And a lot of them will call this area the living room. And it's so funny because we wanted it to feel a little bit more home-like. And so kids, I think, and I don't wear a white coat. I rarely wear scrubs unless I'm scrubbed in for a surgery, and that's the only time I wear my scrubs. But otherwise, we're in street clothes basically, and the kids are a lot more comfortable seeing us. And
you've really created a beautiful kind of vision for the space and executed, because when you walk in, you feel very comfortable here. It's definitely a place where I know kids are feeling comfortable, parents are comfortable, caregivers, all of that. And just kudos to you in building something so beautiful. And thank you so much for the partnership. Thank you for the equipment partnership and what you placed in your office. And just congratulations to you, especially on your new certification.
I appreciate it. Thank you. And Schein has been instrumental, and no pun intended. Cut that part. And helping us with, you know, because when you're worried about technology, or you're worried about certain things working or equipment, it takes away from the fluidity of the practice. And when you have everything working well, you're sure of the quality of things, it makes you feel and appear, and you are more competent to the family. And so it helps, you know, drive home, you know, if they need treatment or if they don't. And it just helps everything come across cohesively. So I'm really appreciative that you do such a fantastic job at getting us all the information that we need, and like helping us to compare the pros and cons of everything. So I really, really appreciate your professionalism and your expertise. I really appreciate it.
Thank you. It means a lot. I'm grateful for the partnership.
Thank you.
Cool. Thanks.